Hi ladies, welcome to week 36. It's been an interesting week. Start off with, I had a day where I felt so emotional. I just wanted to cry. I just felt really stressed out. I don't know, I guess it's getting down to the end, so I don't know, whatever, pregnancy hormones. I only had it once, so it's not, a real big deal, but yeah. I'm continuing to have some sort of sharp pains down below, like my cervix area. I've been having a lot of mild cramping. It's not it's not regular, or I don't think it's to do with having contractions or anything, because my Braxton Hicks contractions, when I have them, my whole stomach goes hard, whereas with the cramping, it's just it's not even bad. It's not painful. It's just, when you're just about to start your period, and you just get that niggling, gross, sort of horrible feeling in your abdomen. It's like that. It's not even full-blown cramping or anything. It's not painful at all. It's just that blech type feeling, and just kind of annoying. So I've been getting it every single day. I've been getting Braxton Hicks contractions like it's nobody's business. I just get them so much during the day. And then with the cramping, I get it at least 1 or 2 times a day. So I'm taking that all as good signs that things are moving along as they should. And it's kind of putting my mind more at ease in regards to having to have another C-section. Because I figure, if it's all looking like it's, heading in the right direction sort of thing, then I'm hoping, I just go into labour on my own and skip the whole C-section drama. Some days she gets really low, and it literally feels like I just have her tucked in the front of my jeans. I can feel her in there moving and sort of pushing against my jeans and stuff. It's really bizarre. It's a little bit uncomfortable. My nose. I am having a lot of my glasses are crooked. I'm having a lot of sort of bloody snot. I haven't had any blood noses. Just I feel like I have a lot of snot in there. And obviously when I blow my nose, it's bloody and whatever. So that's lovely. Caden is sick at the moment. He's been sick for about 3 days now. Just a cough and runny nose, and he's having some, breathing stuff. But he's been having Ventolin, and he's had prednisolone, so I'm hoping it doesn't progress to where he needs to go into hospital again. But yeah, I think I've caught it, because during the night I just get a really sore throat, and I'm all phlegmy, and then in the morning, I guess because I'm upright, it starts coming down, and it's just TMI, but I'm having to hock really gross snot balls. That's probably way too much information, but it's gross. But I'm not coughing or anything like that, so I guess it's just a milder version of what Caden has. I haven't spoken about CM before, but I'm having a lot of milky CM. Another bit of TMI, but I don't know. I don't know if that's sort of I don't know if that's a sign that things are progressing down there, or whether that's just just what happens because of what do they say? Because there's increased blood flow down in that area, all that stuff goes on and blah blah blah. The foot and leg cramps have fully died off. I really don't get them anymore, unless I'm stretching, then I might get one, but like, you know, when you stretch, you have your toes pointed. All I have to do is like put my foot facing up, and the cramp will go away, and it's not a problem. So that's really great, because they were really starting to piss me off. I'm not sure if it's pregnancy related, and you're not going to be able to see it on this video, but on these 2 fingers, I've just gotten like a little bit of a rash. It's pretty much almost gone now, so I'm not sure if that's from pregnancy or that's something else, but yeah. Still no more stretch marks at all, just that tiny little one that's above my belly button, which is awesome. But I keep feeling like I'll get a little bit itchy, or I'll feel like a bit of a pain on the like close to my belly button, but sort of on the side, and I just keep thinking like, oh, that's going to be a stretch mark, I bet you anything. But I actually have not gotten any more, so that is awesome. Also, I'm not swelling at all anywhere. Everything. Oh, I got a pedicure. So I have pretty pink nails, and I also got a manicure. Oh, it was supposed to be like something nice and fun, nice and relaxing that me and my nan could do together, but turns out they do it in separate rooms, so it was like, oh, well, that defeats the purpose of doing it. And it really wasn't as relaxing and pampering as I had thought they were, because I've never had a manicure or a pedicure. I've had acrylics done in the past, but I've never had just like a manicure on my, you know, natural nails. So yeah, I wasn't too happy with that. But anyway, yeah, so I'm not swelling. I have no swelling anywhere. My rings still slip on and off, no problem. You can obviously see that I'm not swollen in my face or anything, so I'm really happy about that, because I know that most women do sort of swell up around now, even before now. But I know that you can swell in labour and all that too, so that's probably when I'm gonna start ballooning. She moves a lot, like crazy, a lot. Always moving. It feels like she barely ever sleeps. And because she's so big, like, oh, it's just her. You can tell she's just like so cramped in there. She's just trying to stretch out for some space, and it just makes me feel. It's hard to describe. Anyone who's been pregnant will, know the feeling, but it's like, I don't know, just like your skin is stretched to its limit, and so I'll have to get her and I'll push her back in to get some relief. The other night, I actually, what was it? It was about, I think it was just before 6 or something. Don't know. But I was just in the lounge watching TV with my nan, and I suddenly noticed that I'd had like 3 Braxton Hicks contractions in a row, like with, a space in between, and they lasted, I didn't time how long they lasted, but it was probably about, I don't know, maybe a minute, less than a minute. Yeah, I would say less than a minute. And they were about 6 minutes apart. No pain at all. Just my stomach tightening and going hard. And so for the next hour, I just jotted down what time I was having each one. And they were roughly about 6 minutes apart each. But there were some that came, closer, like 3, 4, 5 minutes apart. But, because there was no pain, no bleeding, like nothing like that, after an hour, I was like, ugh, I can't be bothered monitoring these anymore. I know they're nothing, so I'll just, whatever. But, yeah. So since then, I have them a lot on and off during the day. Yeah, just having them a lot more than I have been for the rest of the pregnancy. The acid reflux, I would say, or heartburn, whatever you want to call it, has gotten worse. Like, it's still not extremely bad, but like the burning sensation is hotter, sort of thing. So in that regard, it is worse. Oh, and also, when I have it, I always feel like I need to burp. But if I try and just like let up a little bit of it, like just get out the burp a little bit, sort of thing, yeah, whatever I've eaten or whatever just sort of tries to come up, and that burns even more. So yeah, gotta like try not to burp if I have it, because it's just gross, and It's just gross. I packed my hospital bag and her bag the other day, a couple days ago. That took forever. Jeez. I didn't even really pack a whole lot. Like, I don't think I overpacked. But still, like, it's hard to know because obviously I've never been in labour before. And, you know, when Caden was born, it was just sort of a matter of, okay, things aren't looking too good, so I'm going to send you to the main hospital. And, you know, maybe just take a bag just in case they keep you overnight. So, you know, I just grabbed makeup, something to sleep in, change of clothes, and, like, that was it. You know, like, and with this, you know, you've got to pack maternity pads, nursing pads, stuff to labour in, stuff you're going to wear afterwards, something you're going to wear home and feel comfortable in, and then you got to pack the baby's bag. So it's like, I don't know. I know you can find lists everywhere on the internet of what to pack and all that, and there's tons and tons of videos on YouTube of what other ladies have packed, but when you actually get to it, it's like, oh, should I take this or that? It's like, oh, I don't know, it's just a little bit, it's overwhelming really. And then to think, like, you know, next week I'm going to be full term, like, I could be holding this baby in a couple of weeks. It's just crazy. I just can't even believe that I'm at that stage already. That, you know, I should have probably packed that bag a couple of weeks ago. I mean, it doesn't matter because obviously I haven't got into labour, but it's just insane to be at that point and a bit overwhelming, I guess. And I'm worried about forgetting something that I'm going to need, and I'll do my hospital bag and the baby's bag after this video. And you can tell me if you think maybe I've missed anything. There are still a few things. I won't even bother getting into it because I'm going to do separate videos. Anyway, moving on. My next midwife appointment is on Tuesday. So what's that? That's about 4 days away. So I'm going to, you know, talk to her obviously about all the Braxton Hicks and the cramping, see what she says. I'm actually going to find out whether she's willing to check me for dilation. Because I'm in the midwifery group practice, yeah. They're not like real invasive like the normal doctors and nurses are. So they're more like hands-off approach and just sort of let it be. So yeah, and being that I'm only 36 weeks, I don't know, maybe they only start to check from 37 weeks or something. I don't know, but I'm going to ask anyway, just because I'm curious to see if all this cramping and stuff is a sign that I am beginning to dilate. And it'd just be interesting to know, like, I don't really expect, like, I wouldn't be shocked if I was 1 centimetre dilated, but I mean, who knows? I don't even know if I dilated with Caden because I was never checked. It was just, okay, your baby's not doing well, we're going to go in and take him out. There was no, you know, nothing was done in my downstairs area other than a catheter because he wasn't coming out that way. So I don't know, it would be interesting just to see if I am, and if so, how far dilated or effaced or whatever I am. So I'll ask and see what she says. I mean, I guess they can't really say no, can they? If I'm asking, like, I would like to know, so I'm going to take a couple minutes of her time. That's another thing. Does it hurt to be checked? Because obviously I've never had my cervix checked. So that'll be a new experience. Anyway, I guess that is all. My weight, 73.8 kilos, so that is a total gain of 11.3 kilos, I believe. And now I'll do a belly shot and measurement, and that'll be it. And then I'll do my hospital and baby bag videos. Yes, and I will see you for week 37 next week. Most of my friends and family think I'm going to go early, so they think I'm going to go at about 38 or 39 weeks. So we shall see. So, from the front, from the side, the side, I don't know where you can see that with the pale background, but there you go. So no stretch marks as of yet. Well, I'm showing my bra. Oops. And the measurement. Oh, that tape measure is cold. I can't feel that. That says 104. So that would mean I've lost 2 centimeters. Let me know if you think I've dropped. I don't know how well you can see with that light background, but oh, here we go. I'll use this. Is that any better? Yeah, so do you think I've dropped it all? I don't know. I still look square. Okay, that's it for week 36. Yes, let me know if you think I look like I've dropped. I mean, my measurement says that I've lost 2 centimeters on my bump, so I don't know, I feel like she floats up and down. Oh, that's another thing I didn't mention. I'm getting breathless a lot. Like, I'm breathless now just from doing that belly shot, so alright, I'll see you all for week 37. Bye.